Great to have you with us. I'm Gareth Edwards. This is All Angles on eNCA. I mentioned we're going to talk about alcohol taxes in South Africa. It's exactly what we're going to do now, especially as we go into long weekends. A lot of people do go out and they enjoy their favorite tipple. Sadly, some people simply go too far. So are higher taxes for alcohol? It's a major debate at the moment of whether or not it's going to work. What's the actual point? National Treasury wants to raise alcohol taxes and set a minimum price for your favorite tipple. Now, here's the problem. Two sides to the story, as there always are. Supporters say the measures could curb harmful drinking and reduce the health and social costs linked to alcohol abuse, while the liquor industry is warning that this could hurt jobs and fuel an illicit trade. We think back to 2021, don't we, during COVID? Well, Dr. David Harrison is the CEO of the DG Murray Trust. Been dying to get his view on this. And Doctor, great to have you on eNCA. Tell me about your view on this and the Trust. Where do you come into this conversation? Where's your stance?
Well, our interest is in developing a safer, healthier South Africa, and building the economy at the same time. What we know is that low to moderate drinking, 2 drinks a day, is perhaps not so fine for individuals because it is a carcinogen, but it is good for the economy. Up to 2 drinks a day, fine. Beyond that, seriously bad for the economy. The problem we have in South Africa is that of drinkers, 3/4 drink more than 2 drinks a day. And so the pendulum has swung in South Africa from an industry that may be regarded as economically beneficial to economically harmful overall. And we have 1/4 of heavy drinkers in South Africa saying they're drinking more than 6 drinks a day. So we've got to be careful in saying, well, this is about, on the one hand, health and pulling in the opposite direction, wealth and economic growth. Actually, the two go in the same direction. What's good for health is good for the economy. What is clear is that reducing heavy drinking is going to improve our society and improve the economy at the same time.
We've seen this argument before, though, Doctor. Tell me what you make of what we've seen over the years, the sin taxes. We just like to bracket them as sin taxes because there's so many every budget speech, cigarettes, alcohol, etc. The idea of pushing up the prices doesn't seem to make a difference. I remember speaking to a psychologist earlier this year about the sin taxes, that people would rather cut back on other necessities in order to buy the tipple, in order to buy the smokes. The higher taxes doesn't seem to achieve the outcome, does it?
Well, there are always some people who respond like that. But what we must do is look at the science, both in South Africa and across the world. And if we do that, the evidence is unequivocal. Increasing excise taxes, which is the taxes paid by the manufacturer, which gets passed on to the consumer, and it's meant to offset the harm that's done by industry. Increasing excise taxes unequivocally, quite clearly, reduces overall consumption across the world. High-income countries, low-income countries, middle-income countries. It reduces the number of hospital admissions. It reduces the number of deaths, gender-based violence, fetal alcohol syndrome. It's absolutely clear. It's unequivocal. It cannot be questioned. Now, that's not to say that you speak to an individual and they'll say, oh, no, they carry on drinking and they cut back on food. But overall, in the aggregate, if you have a look at the effect, it's absolutely clear. Now, what about the argument about illicit drinking? Let's be clear. Illicit drinking is a crime. Illicit markets are a crime. The people who sell it to individuals, they are criminals. In the same way that the construction mafia are crimes. But we don't stop infrastructure development. We don't stop. Because of construction mafia, we don't stop giving people grants because of administrative fraud. We have to deal with those. And what countries have shown is that you can deal with illicit markets. You can actually have countermeasures in place, track and trace systems, other systems to prevent it, and that can keep illicit trade at very low levels. But the point is that even in countries like Russia that have extremely big illicit markets, always have, before the excise taxes were increased, still the effect was huge. Why? Because heavy drinking is of both legal alcohol and illegal alcohol. And legal alcohol contributes 80% of the harm that I'm speaking about today. 80% of the homicides, of the traffic injuries, of the fetal alcohol, of the gender-based violence. So that's what needs to be tackled, even as we put in place the type of countermeasures to prevent illicit markets from expanding.
Doctor, perhaps a last question, two-pronged if I may. One is, do we have a case study? You mentioned a few countries there where they've taken action against alcohol abuse. Do we have a case study of a country where the higher taxes have achieved less alcohol abuse? One. And then two, what are you actually calling for? Who would you like to do what to solve this particular issue? Last question.
Let's start with that. What we know is that the harm is directly related to the amount of pure alcohol that you take in, the ethanol that you take in. So what we want to see is a reduction of the amount of pure alcohol that's consumed. Countries like the UK, for example, have increased taxes, but on a sliding scale based on the strength of alcohol. And the consequence has been that the country has reduced the liquor industry has reduced the strength of its major brands. And initially everybody said, no, you can't do that. Actually, it's accepted now. In South Africa, we've done it. There's a brand, and I won't mention its name, but has a lighter quantity, lighter strength that now constitutes 15% of the total market. So that's what we want to achieve. We're not trying to destroy the industry. What we're trying to do is optimize the economic benefit of the industry, and that requires us to reduce the amount of alcohol, of pure alcohol, that is consumed in this country.
Doctor, thank you very, very much. I do appreciate your time. Fascinating debate. It's an ongoing debate at the moment. How do you feel about it? What would you do when it comes to higher taxes on alcohol in South Africa? That was Dr. David Harrison, CEO of the DG Murray Trust, giving us their view. Is that the way to go? Higher taxes? Reduce the drinking? Is it as simple as that? I'd love to get your comments on social media.